Hello, my name is Erica Garcia. I'm an infectious disease epidemiologist, and I will be talking to you today about Zika virus. The objective of this presentation will be to describe the disease and transmission, identify key preventive actions, list the main challenges in prevention and control. Just to give a little bit of a background of Zika virus disease, Zika virus disease is typically a mild disease that is caused by the flavivirus transmitted primarily by the Aedes mosquito. Prior to 2015 and 2016, little was known about Zika virus. In 2015 and 2016, Zika virus emerged in the Americas, along with an observed increase of microcephaly in newborns and also neurological complications such as Guillain-Barré syndrome. Since that time, a lot has been learned about Zika virus. There is now scientific agreement that Zika is a cause of microcephaly and other congenital malformations and Guillain-Barré syndrome. Research findings continue to build our understanding of the virus and its public health implications. So, Zika virus is transmitted mainly by Aedes mosquitoes, specifically Aedes aegypti and Aedes albopictus. Not only can it be transmitted through the bite of an infected mosquito, but it also could be transmitted sexually. There are other pathways, including transfusion, lab contamination, perinatal transmission, and all of these types of transmission have been reported in the past, and they're still being investigated. It's important to know that the Aedes mosquito also transmit other viruses, like yellow fever, dengue, and chikungunya. This is the epidemiological triad of Zika virus. On one apex of the triangle, you will see the animal reservoir, where Zika virus could cause epidemics, and there could be migration of non-human primates into different areas where humans may be inhabiting. We also have the mosquito that contributes to the transmission of Zika virus, and several factors that play a role in transmission is the type of mosquito, how they reproduce, and the domestic or sylvatic cycles that they may have, and also the vector density of the mosquito that transmits Zika virus, in this case Aedes aegypti and Aedes albopictus. And in the other apex of the triangle is the human component, where we need to look at the density of human populations, human activity, their immunity, and also migrations of human populations that may be interacting with mosquitoes or with animal reservoirs. And we see that ecological factors play a role in the transmission of Zika virus. What are the signs and symptoms? The symptoms normally last 2 to 7 days and can include mild fever, skin rashes, conjunctivitis, muscle and joint pain, malaise, or headache. Zika virus, as we talked about earlier, is a cause of congenital microcephaly and other manifestations. But just to define microcephaly, microcephaly is a condition in which a newborn has a smaller head than those infants that are born at the same time and also with the same sex. So other manifestations that can be seen in babies that were infected with Zika virus during pregnancy include seizures, irritability, brainstem dysfunction, swallowing problems, limb contractures, hearing and sight abnormalities, and brain anomalies. Just to note, microcephaly is a very rare condition, and normally only 1 in several thousand infants born have this condition. There are other reported outcomes due to Zika virus infection during pregnancy, and that is miscarriages and stillbirths. Another consequence of Zika virus that was seen during the emergency of 2015-2016 is the onset of Guillain-Barré syndrome, which is a neurological syndrome observed in adults that are infected with Zika virus. Guillain-Barré syndrome, also known as GBS, is a rare condition in which a person's immune system attacks the peripheral nerves. People of all ages can be affected, but it is most common in adults and in males. Most people with GBS fully recover. There are severe cases of GBS, but again, they are rare, and they can result in almost near total paralysis. GBS is potentially life-threatening, so it is a serious condition. And GBS needs to be well monitored, and also patients need to be treated. And some may even need intensive care. In terms of surveillance, countries may develop a local approach for enhanced surveillance for Zika to see if there's the Aedes vector circulating in the areas. In humans, it's advised to establish surveillance for neurological complications, including Guillain-Barré syndrome, myelitis, and acute disseminated encephalomyelitis. We need to ensure that public health laboratory has the capacity to test for Zika, and we need to investigate unusual clusters of rash and illness. But countries may also develop surveillance in non-human primates, as we talked about during the epidemiological triad slide. So with regard to diagnosis and treatment of Zika virus, to diagnose Zika, there needs to be laboratory tests that need to be conducted on blood and other bodily fluids, for example, urine, saliva, or semen. PCR test is used during the acute phase of the disease. And there's also a serological testing that can be done, but needs to be confirmed with plaque reduction neutralization test, also known as PRNT. It's important to note that as of yet, there's no available commercial serological kit. The treatment for Zika is quite simple. People with Zika infection should drink enough fluids, they should get plenty of rest, and they can treat their fever and pain with common medicines. So there is no specific cure for Zika virus disease. How is microcephaly diagnosed as one of the complications of Zika virus infection among pregnant women and neonates? So microcephaly is diagnosed most often at time of birth or possibly at a later stage. The head circumference should be measured within the first 24 hours after birth, and then it needs to be compared with WHO growth charts. The result is then interpreted in relation to the gestational age of the baby and also the baby's weight and length. Early diagnosis of microcephaly can be done, and it's made by using a fetal ultrasound, best after week 28 of gestation. It's important to note that there's no specific treatment for microcephaly. Early intervention with stimulation and play programs may show positive impacts on development. What's needed is a multidisciplinary team in order to assess and care for the babies and children with microcephaly. Family counseling and support for parents is also an extremely important component. In order to diagnose patients with Guillain-Barré syndrome, it's important to conduct a neurological examination, including the diminishment or loss of deep tendon reflexes. A lumbar puncture may be done, though it should not delay treatment. And other tests, such as blood tests, to identify the underlying trigger are not required to make the diagnosis and should not delay treatment. The treatment for Guillain-Barré syndrome is that it should be supportive. Acute phase is typically treated with immunotherapy. There is no specific treatment for GBS. How can we prevent from having Zika virus infection? The main protection against mosquito bites is the key measure to prevention. So one of the things one can do is wear light-colored clothes, use physical barriers such as window screens or closing the doors and windows. Mosquito bed nets can also be used for the protection of babies and for patients that are bedridden. It's important to note that Aedes mosquitoes typically feed during the day. They're most active at dusk and at dawn, and not necessarily in the evenings. So it's important to use insect repellent, and it's also important to get rid of mosquito breeding areas. We could also prevent Zika transmission through the prevention of sexual transmission. Men and women returning from areas where we know that Zika virus is circulating can adopt safer sex practices or consider abstinence for at least 6 months after return from a Zika-infected area. In regions where there's active Zika transmission, pregnant women should practice safer sex or abstain from sexual activity for at least the whole duration of the pregnancy. One of the key challenges of Zika is actually identifying Zika virus disease because its symptoms are one, mild, and also very similar to other diseases such as dengue and chikungunya. The diagnosis of Zika is also very challenging because there's no diagnostic tests that are currently available. And there is also a lot of cross-reactivity in lab testing, therefore making it difficult to interpret the lab test results. Approximately 80% of the cases are asymptomatic, according to some of the literature that has been published recently. This makes it very difficult in order for countries to report cases. Also with vector control, right now the current methods used to control Aedes aegypti and Aedes albopictus are not working most efficiently. Due to climate change, there are now new areas hospitable to Aedes mosquitoes. Also, it's important that there is no vaccine available. There are vaccine candidates that are currently undergoing some testing, but currently we don't have a vaccine for Zika virus. A key concern about Zika is that little is known about the extent of the public health impact in terms of its neurological complications. Another concern is that there's no reliable diagnostic testing for Zika, and this could be particularly concerning for women who expect to be pregnant or who are pregnant. In terms of long-term consequences in infants born with microcephaly and other congenital malformations, we need to ensure that our public health systems are strengthened and can address these long-term consequences. Also, we observe that the epidemiological pattern of Zika virus has changed over time, resembling dengue and chikungunya. Humans are the amplifying host in urban areas, and the same mosquito vectors are implicated in resulting very large epidemics. So there are drivers that are contributing to Zika emergence and other mosquito-borne diseases, such as human population growth, climate change, rapid urbanization, globalization, and vector control needs to be strengthened. So what are the next steps for WHO in order to address Zika virus as a global health threat? We need to stimulate research. We need to enhance research in the Aedes transmitted diseases and diagnostics. We need to look at our vector control measures, find new tools for vector control measures. We need to look at the environmental determinants and develop vaccines and immune response modalities. WHO also needs to form new global alliances to combine efforts and resources efficiently and timely. We need to combine strategies and interventions from multiple diseases for effectiveness in reducing morbidity. So my name is Erica Garcia. I'm the disease focal point for chikungunya and Zika control. You can contact me at garciaer@who.int. Thank you.